If you are currently over the age of 60 and residing anywhere in the United States, set aside whatever you are doing at this moment because legislation that just cleared the United States Senate has the potential to directly influence your retirement income, your access to medical care, and your overall financial well-being beginning as early as this year. A landmark elder care protection bill has been advanced through the legislative process, and the reality is that a vast number of retirees throughout this country still do not have a complete understanding of what this legislation actually contains. We are talking about meaningfully reinforced protections designed to prevent abuse inside nursing care facilities, newly established limits on what seniors are required to pay out of pocket for prescription medications, and revised guidelines that have the potential to increase the amount of money deposited into your Social Security payment each month. But here is the critical piece that most major news sources are leaving out of their coverage entirely. Not every single change written into this bill takes effect automatically for every eligible person. Certain benefits are only accessible to individuals who understand the specific process required to claim them, and some of the provisions attached to this legislation carry deadlines that you could unknowingly allow to pass if you postpone taking action. Throughout this video, we are going to walk through every meaningful change contained in this bill using language that is clear, direct, and easy to follow. No confusing legal language, no slant toward any political perspective, just honest and accurate information so that you and the people in your life know exactly what you are entitled to and what concrete steps you need to take starting right now in order to protect the future you have worked so hard to build. If you genuinely believe that every senior in this country deserves a clear and complete understanding of their rights, take a second to tap the like button right now. That small action helps us reach more retirees who need access to exactly this kind of information. Our commitment is to make sure that not a single person gets left in the dark about what they have earned and what belongs to them. Welcome back, everyone, and thank you sincerely for spending this time with us today. If you have been following along with recent developments in national news, you are likely already aware that something of considerable importance just unfolded in Washington, something that carries real and direct consequences for you personally, for your husband or wife, for your aging parents, or for any individual in your circle of relationships who has passed the age of 60. The United States Senate has formally voted to approve the Elder Care Protection Bill, and the effort to bring this legislation into existence has been a sustained and determined undertaking spanning a number of years. This did not happen as the result of a single session or a straightforward process. It emerged from prolonged and often contentious debate, careful examination by multiple legislative committees, significant setbacks that required the effort to be rebuilt, and numerous rounds of revision before reaching its final form. And now it carries the full weight of law. So what we are going to do today is take you through a complete and detailed walkthrough of everything you need to understand about this legislation from beginning to end, without skipping over anything or rushing past the parts that matter most, because having the full picture is exactly what you deserve. Let us start at the very beginning because understanding the circumstances and history that gave rise to this bill provides essential context for appreciating why its passage matters as much as it does. For a very long time, spanning multiple decades, older Americans in this country have faced the ongoing challenge of navigating a system that frequently fell short of meeting their needs in meaningful ways. The price of prescription medications climbed consistently higher with no effective mechanism to bring those costs under control. Facilities providing nursing care to some of the most vulnerable members of society operated with levels of accountability that were far too minimal to ensure resident safety and dignity. Annual adjustments to Social Security payments repeatedly failed to reflect the actual rate at which the costs seniors faced in their daily lives were increasing. Financially motivated schemes specifically designed to target older individuals succeeded in stripping away the savings that many had spent their entire working lives accumulating. These were not peripheral or minor inconveniences affecting a limited number of people. They were deeply serious and broadly felt problems that disrupted the lives of millions of households in every corner of the country. And the troubling reality is that much of this continued happening without generating the level of sustained attention and legislative response that the severity of these issues warranted. The Elder Care Protection Bill that has now become law stands as one of the most comprehensive and wide-ranging pieces of legislation specifically dedicated to the welfare and protection of older Americans to emerge from the legislative process in many years. Its scope encompasses healthcare access and affordability, housing quality and availability, financial security protections, and the personal physical safety of seniors living in care environments. And while the news coverage of major legislation tends to remain focused on the broad strokes, the genuine and lasting value for real people is embedded in the specific provisions that connect directly to the details of your everyday life. Let us begin by examining the changes related to prescription drug pricing, because this area arguably contains some of the most consequential reforms found anywhere in the entire bill. For individuals enrolled in Medicare, what has been written into this legislation represents something that large numbers of seniors have been hoping and advocating to see for many years. Under the regulatory framework that existed prior to this legislation, Medicare operated under an explicit legal prohibition against negotiating medication prices directly with the pharmaceutical manufacturers responsible for producing those drugs. Pause for a moment and allow the full weight of that reality to register. The single entity purchasing a greater volume of prescription medications than any other buyer in the entire country was legally barred from negotiating the prices it paid for those medications. At the same time, private health insurance companies and even the Department of Veterans Affairs possessed the legal authority to negotiate those exact same prices and use that leverage to secure more favorable rates for the people they served. The direct consequence of this structural imbalance was that American seniors found themselves paying medication costs that ranked among the highest of any nation in the developed world. Under the framework established by this new legislation, Medicare is now empowered to negotiate pricing on a significantly broader range of prescription drugs, and the timeline for bringing those newly negotiated prices into effect has been substantially accelerated compared to what any prior arrangement allowed. What this means for you in the most practical terms is that if you are currently spending several $100s every month maintaining access to the medications you depend on, there is a genuine and realistic possibility that those expenditures will begin declining according to a phased implementation schedule that gets underway in the relatively near future. The legislation additionally places a firm ceiling on the total amount any individual will be required to spend out of pocket on prescription drugs over the course of a single year, regardless of how many different medications are part of their treatment or what those individual medications cost. For a significant portion of seniors managing their budgets on a fixed monthly income, this specific change alone carries the potential to fundamentally alter their financial circumstances for the better. Now, let us move into the discussion of Social Security, because this is consistently the area that commands the most focused and personal attention from the people watching. Social Security has functioned as the central pillar of financial stability and retirement for Americans since the program was originally established back in 1935. It was conceived and built as a mechanism for providing reliable and ongoing financial support to individuals who had devoted years of their lives to contributing to the workforce and to society. But as the program has evolved and as economic conditions have shifted over the decades, a growing number of retirees have developed the sense that the adjustments being made to their monthly benefits were failing to keep up with the actual financial pressures they were navigating in their real lives. The fundamental source of this disconnect traces back to the specific methodology used to measure inflation for the purpose of calculating benefit adjustments. The measurement index currently in use is built around spending data collected from individuals who are still actively employed rather than from retired populations. But retired seniors allocate their spending in substantially different ways than working people do, directing disproportionately larger shares of their income toward healthcare services, prescription medications, and other essential expenses that have historically increased in cost at rates that outpace broader inflation measures. This new legislation advocates for and moves toward the adoption of a revised inflation measurement approach that is specifically designed to capture and reflect the actual spending realities of retired Americans in a more accurate way. As this updated methodology takes hold and its effects accumulate over time, the likely outcome is meaningfully larger annual cost of living adjustments to monthly benefit amounts, translating directly into additional money in your Social Security payment each month. The incremental difference in any single year may not appear substantial at first glance, But when those annual improvements are allowed to compound across the full span of a retirement that may extend for many years or even decades, the cumulative financial impact becomes genuinely significant. The legislation also incorporates specific measures directed at reinforcing the structural financial health of the Social Security system over the long term by revisiting and adjusting the payroll tax contribution thresholds that currently apply to individuals with higher annual earnings. This approach contributes to stabilizing the overall financial foundation of the program and works to meaningfully reduce the likelihood that future generations of beneficiaries will face the prospect of reduced payments. Let us now turn our attention to the nursing home reform provisions of this legislation, because this section carries profoundly important implications, particularly for anyone who has a family member currently living in a care facility or for anyone who may be anticipating that need arising in the coming years. Documented evidence gathered over an extended period has consistently surfaced troubling and recurring problems within nursing home environments operating across the country, including chronic shortages in qualified staffing, substandard physical living conditions, and in the most serious and disturbing cases, documented patterns of abuse and neglect directed at residents. The new law establishes mandatory staffing standards with real enforcement mechanisms supporting them. Every covered facility is now required to consistently maintain minimum ratios of qualified caregiving staff relative to the number of residents in their care. In practical experience for residents and their families, this standard translates into greater individualized attention throughout each day, meaningfully faster response when a resident requires assistance or medical attention, and a generally elevated standard of care quality across the facility as a whole. The financial consequences that facilities face for failing to meet these standards have also been substantially increased in severity. Under the rules that existed previously, monetary penalties were frequently modest enough in scale that many facilities absorbed them as a routine operational cost without making any genuine effort to improve their practices. Under the new regulatory framework, facilities that accumulate repeated violations now face the potential loss of their eligibility to receive Medicare and Medicaid reimbursements, which represents a financial consequence serious enough to force substantive operational change. Requirements around public transparency have also been significantly strengthened as part of this legislative package. Nursing home facilities are now mandated to make their inspection records and performance evaluation data far more readily accessible to members of the public than was previously required. This improvement equips families with the detailed and reliable information they need in order to make genuinely well-informed decisions during the process of selecting a care environment for a loved one. Let us now examine the provisions addressing financial fraud targeting elderly Americans, because this has emerged as an increasingly severe and wide-reaching problem in communities throughout the country. On an annual basis, older Americans are collectively defrauded of billions of dollars through an ever-expanding variety of criminal schemes and deceptive practices. These range from fraudulent telephone calls made by criminals impersonating federal government agencies to sophisticated investment fraud operations and, in some cases, outright financial exploitation carried out by individuals who hold positions of personal trust with the victim. This legislation allocates substantially increased funding to fraud prevention initiatives and to the enforcement actions necessary to hold perpetrators accountable for targeting vulnerable seniors. Financial institutions operating across the country are being actively encouraged to build out monitoring systems capable of detecting suspicious transaction patterns and to establish protocols for reporting those findings through appropriate channels. The bill also creates new public education programs, specifically designed to equip older adults with the awareness and recognition skills needed to identify the warning signs of potential fraud attempts before those attempts succeed in causing financial harm. Equipping people with accurate knowledge and clear awareness stands as one of the most powerful and effective protective measures available in the ongoing effort to reduce financial exploitation of seniors. Housing represents yet another area of significant focus within the scope of this legislation. A substantial number of older Americans hold a deep and understandable desire to continue living within their own homes for as long as their health and circumstances permit, but those homes frequently require targeted physical modifications in order to remain genuinely safe and fully functional environments for individuals whose mobility and physical capabilities have changed with age. This bill meaningfully expands the funding available to support home modification projects, including the installation of wheelchair accessibility ramps, the widening of standard doorways to accommodate mobility assistance devices, and the renovation and updating of bathroom spaces to significantly reduce the risk of dangerous falls and related injuries. These types of carefully targeted home improvements play a direct and important role in enabling older adults to preserve their independence and remain in familiar surroundings for a meaningfully longer period. The legislation also channels investment toward the development and expansion of affordable housing communities, specifically planned and constructed with senior residents in mind, placing strong emphasis on accessibility features built into the physical design and on creating opportunities for meaningful social interaction and community connection among residents. This emphasis on combating social isolation is grounded in well-documented research, consistently demonstrating that chronic loneliness and disconnection among older adults is associated with significantly elevated risks across multiple dimensions of physical and mental health. Mental health receives explicit and dedicated attention within the bill as a recognized area of need among the senior population. The range of therapy and professional counseling services accessible to older Americans through Medicare is being expanded, with specific attention given to ensuring that telehealth delivery options are readily available as a convenient and accessible alternative to traditional in-person appointments. This expansion carries particular significance for seniors who are working through the emotional challenges associated with personal loss, the daily management of chronic health conditions, or the psychological and emotional weight of sustained social isolation from family and community. Support for the millions of family members who provide unpaid caregiving services to aging relatives is established as a major area of dedicated focus throughout the bill. These individuals frequently sacrifice enormous amounts of their own time, energy, financial resources, and career advancement in service of caring for people they love, and the toll that sustained caregiving places on them is both significant and often invisible to policymakers. This legislation introduces tax credit provisions, access to structured training and education programs, and respite care options specifically designed to provide meaningful and practical relief to these dedicated individuals. The bill also advances the ongoing effort to broaden the scope of Medicare coverage to encompass services related to hearing health, vision care, and dental treatment. While the full realization of these expansions remains a work in progress rather than an immediately completed achievement, meaningful forward momentum is being generated through the introduction of targeted financial subsidies and carefully designed pilot programs that establish the infrastructure and precedent for more comprehensive coverage as the implementation process continues to unfold. In addition to all of the above, this legislation introduces strengthened and more clearly enforceable legal protections specifically targeting age-based discrimination as it manifests in both employment contexts and healthcare delivery settings, establishing firmer and more consistently applied standards for ensuring that older Americans are always treated with the fairness, dignity, and respect they are owed. Now, here is a point that deserves your close and serious attention because it has direct practical implications for whether you actually receive what this legislation makes available to you. A meaningful number of the benefits and protections established within this bill will not simply appear or apply to you without any action on your part. Various provisions require individuals to complete application processes, supply updated personal information to the relevant administrative agencies, or take specific steps within defined timeframes in order to gain access to the benefits they are eligible to receive. The most practical starting point is to make direct contact with the Social Security Administration, or to visit their official government website where detailed and personalized information relevant to your specific circumstances can be accessed. You also have the option of connecting with a trained Medicare counseling professional through the State Health Insurance Assistance Program serving your state. These counseling and advisory services are provided at absolutely no cost to you and exist for the specific purpose of helping you navigate your options with confidence and clarity. It is equally important to remain alert and appropriately cautious regarding fraudulent schemes that will inevitably attempt to exploit public awareness surrounding this legislation. No legitimate government agency, official program, or authorized representative will ever contact you unsolicited and request payment or ask you to provide sensitive personal information over the telephone. If any communication you receive triggers concern or feels in any way suspicious, go directly to official government sources to verify the information independently before taking any action whatsoever. As we bring this discussion toward its conclusion, take a genuine moment to reflect on what all of this actually means for your life, your security, and your future. This legislation is not a comprehensive or perfect answer to every challenge that older Americans face in navigating daily life and the complexities of retirement, but it does represent a substantial and meaningful advancement in the right direction. It confronts real problems that real people have been living with and struggling against for years, and it establishes genuine and concrete support structures for seniors living in communities throughout every part of this country. Perhaps most significantly, it serves as a formal acknowledgement that the challenges and concerns of older Americans are being seen, taken seriously, and responded to with tangible legislative action. Remaining consistently and actively informed about developments of this kind is not optional if you want to protect what you have earned. Understanding precisely what benefits you are entitled to and following through on the necessary steps to secure those benefits when specific actions are required on your part can produce a meaningful and lasting difference in both your financial stability and your broader sense of personal security as you move forward. If you found this breakdown genuinely valuable and informative, please take a moment to pass it along to others in your life who need access to this same information. The more widely this knowledge spreads, the better prepared every person in our community will be to take full advantage of what has been made available. And always hold on to this truth. This is your future, your financial security, and your fundamental right as someone who has given so much to this country throughout the course of your life. Stay consistently informed, remain proactive in understanding and claiming every benefit that belongs to you, and we will be right here with you again in our next update.